Welcome everyone to the January 10th, 2022 Grafton Board of Health meeting. As a preliminary matter, this is Karen Govin, Chair of the Board of Health. Permit me to confirm that all members and persons anticipated in the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. Dan Finn.
Dan Finn, present.
Austin Magnet.
Austin Magnet, present.
Bill Muller.
Bill Muller, present.
And then I know Jen Maynard can't make it this evening. Staff and anticipated speakers are on the agenda. When I call your name, please respond in the affirmative. Nancy Connors.
Nancy Connors, present.
And Colleen Bolin from the Alliance.
Colleen Bolin, present.
All right, thank you all. I'd like to open the meeting. Can I get a motion to open the meeting, please?
This is Dan Finn. I'd make a motion to open this meeting.
Is there a second?
This is Austin Magnet. I will second that motion to open the meeting.
All right, and then roll call vote.
Dan Finn, aye.
Austin Magnet, aye.
Bill Muller, aye.
Karen Gwzdowski-Govin, aye. All right, good evening, everyone. This open meeting of the Grafton Board of Health is being conducted remotely, consistent with the Act extending certain COVID-19 measures adopted during the state of emergency in Massachusetts. This act includes an extension until April 1st, 2022, at least as of right now, of the remote meeting provisions of Governor Baker's original March 12th, 2020 executive order suspending certain provisions of the open meeting law. In order to mitigate the transmission of the COVID-19 virus, the Act extends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed to participate remotely. The order, which you can find posted on the town's website at www.grafton-mass.gov, allows public bodies to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. This evening's meeting does not have any public hearings scheduled for it. For this meeting, the Grafton Board of Health is convening by video conference via Zoom as posted on the town's website as part of our agenda, identifying how the public may join. Please note this meeting is being recorded and that some attendees are participating by video conference. Accordingly, please be aware that other folks may be able to see you and that you take care not to screen share your computer because, as we all know by now, anything that you broadcast may be captured by the recordings. Any supporting materials that have been provided to the members of this body are available on the town's website unless otherwise noted, and the public's encouraged to follow along using the posted agenda unless I note otherwise. Before we turn to the first item on the agenda, permit me to cover just some basic ground rules for effective and clear conduct of our business and to ensure accurate meeting minutes. I'll introduce any speakers on the agenda for topics. After they conclude their remarks, I'll invite the board members to provide any comments, questions, or motions. As always, please identify yourself, board members, when speaking. Further, please remember to mute your phones or your computers when you're not speaking, and then please remember to speak clearly and in a way that helps to generate accurate meeting minutes. For any response, please wait until I yield the floor to you and state your name before speaking. And finally, any votes on any motions made during this meeting will be conducted by a roll call vote. All right. All that being said, let's turn now to our first topic on the agenda, which is the Regional Alliance updates.
Hi, everybody. I'm going to start off with some non-COVID updates and try to switch it up a little. I think we all probably know what's going on in the world of COVID right now. Nothing too promising. So some non-COVID updates to share with everybody. The Regional Youth Health Survey, our epidemiologist, Nikki Nixon, has been working with Grafton Public Schools to be able to finalize the set of questions and to get the Regional Youth Health Survey out the door. So I believe the schools are slated to do the survey this month. So I should have an update by the end of the month, if not certainly by the next meeting. But I believe it is in the month of January that right now they're scheduled to do the survey, both the middle school and the high school. So it'll be exciting to get that data. Also, we have formally reached out to FAB, the Public Health Accreditation Board, and asked for an extension for our reaccreditation. As you may remember, Our accreditation is good for 5 years. So we were originally accredited in 2016. So we were up for reaccreditation in March of 2021, which we asked for a year extension due to COVID. And looking at where we're at right now with the state of COVID, the number of cases, the number of vaccination clinics, and everything else going on, we did reach out to our accreditation specialists and asked for an additional extension. This extension would not be a year. We asked for just 6 months or so. We actually did just secure a consultant who is going to come on board and help us prepare for reaccreditation. We received some funding from Mass DPH. So he's coming on board. Some of you may remember him. It's Zach Dyer. He was our deputy director several years ago before myself. He then left, he went to medical school, and he's in a medical school PhD program at UMass. So I think it's 7 years, and he's in his PhD year right now. So we had posted the scope of work on the city website through the purchasing department, and he had bid on it. And he's actually a wonderful addition to the team because he was around when we did accreditation to begin with. So a lot of it is actually familiar to him already. He was one of the big reasons that we initially got accredited. So we're really excited to have him on board to start that process. It's a pretty lengthy process. So he'll be on board over the next several months to just help us prepare for reaccreditation. So at some point, he will probably be reaching out to all of you, as he will all the Board of Health members in our Alliance communities, just making sure that we have all of our ducks in a row to do the application for reaccreditation. So more to come on that. In addition to that, we had a second scope of work posted on the city website to help us with our business plan and our strategic planning. He also bid on that and was awarded that one as well, which again is really exciting because he just knows our history, right? He's been around for so long previously. He knows a lot of the history. And although he's been gone for several years now, I think in some ways he'll be coming back into it with a fresh set of eyes, but knowing kind of the context of how we operate and where we came from. So he'll be reaching out again to all of you. I think he's going to start with town managers and town administrators within the next couple weeks, but then he'll certainly be reaching out to Board of Health members and lots of other stakeholders we have as well to work on the strategic planning piece, as well as our overall business plan, financials, how we're currently financially structured, and also how just we're structured with staffing, right? How we communicate, how our town managers all communicate, how the city manager fits in there, how the boards of selectmen fits in there, the boards of health in all of our communities. So he's really going to be taking a deep dive into our structure as a regional health district, how we're funded as a regional health district, and then really like what's our strategic plan for the next several years? What are our goals and objectives? And we really want to make sure that these documents are not Worcester centric, right? That these documents represent us as an alliance and not just as the city of Worcester with the alliance communities as quote unquote, contracts, right? That we do work for. We really want to make it a collaborative effort. So this spring, this winter and into the spring, you'll have a lot more communication, both from myself and Karen, as well as Zach, on getting a lot of these plans rolling. So we're really excited to be able to really try to get movement with a lot of these projects that we've wanted to do for a couple of years now, but COVID has really set us back quite a bit. So we're excited to get the ball rolling. Zach's a great addition to that. So definitely more to come on that. The last thing that I will add that's non-COVID related is our FY23 budget. So certainly in the city, we're working on our FY23 budget with our budget office and city manager's office. Certainly, if there's anything we can do to answer, however you're structured in Grafton in terms of developing the budget for the Board of Health office, if there's any questions or any guidance or support that we can provide, I know we do that in Shrewsbury, but if there's any support and guidance we can provide to Grafton, to you as the board or Nancy, please let us know. We're happy to do that. Any questions on non-COVID topics before I just do a couple highlights of COVID? All right, so a couple big highlights. As I said, I think it's no secret to anybody, we are definitely in a very extreme surge, the highest surge we have had yet. Certainly in the city, we're seeing now over 1,000 cases a day, some days of the week, which prior to the surge, I think the most we ever saw in a day was 200 or maybe a little over 200. And certainly I've noticed your daily counts have skyrocketed way up per day as well. I was on a call earlier today with Dr. Hirsch. We were talking to all the colleges in the city, and he really stressed that the messaging is the same, that vaccinations and getting boosted is the best line of defense, and to ensure that we continue to drill that messaging, and that although the vaccine does not necessarily prevent you from getting the virus, it prevents severe illness and certainly death. So we really want to keep hammering that message home. I know our communication specialist, Matt, has been sending stuff out to all the communities, but if there's anything else you're looking for that you haven't seen, please let Matt know, and he can try to tweak anything or look for anything else that may be of interest to you, to really just continue to hammer that message home. There's standing clinics in Worcester every week. So I think today or maybe yesterday, Karen sent out that information, but there's standing clinics every week at the Worcester Public Library, at the YMCA in Worcester. The Senior Center has some clinics. They're open to everybody, and it offers, provided we have the supply, which 9 out of 10 times we're fully stocked on every option. But you can get your first dose, your second dose, your third dose, your booster, from pediatrics all the way through adults. So we're continuing on with that message, continuing on with masking, and really just trying to ask people to just think smart, right? To think smart and be mindful of that social distancing, of wearing your mask, staying home when you're sick, right? If you think it's a cold, maybe it is just a cold. We all know it's cold and flu season. So there's a lot of things going around besides COVID right now, but we also know there's a lot of COVID going on right now. So making sure if you aren't feeling well, if it's, sending your child to school or going to work or hanging out with friends, to be mindful of that, to stay home, take a test if you feel that you need a test. So anything we can do to help with public messaging, please let us know. Any questions you have regarding clinics, please let us know. We can make sure you have all the information we have in terms of upcoming clinics. The last thing I will say is our COVID call log. So the amount of calls that we are getting on a daily basis has skyrocketed as well. I think a couple days last week, we had almost 100 calls in a day, which just COVID related, which is really high for us. But Nancy in Grafton, Nancy has the link. So Nancy's able to log a call. We all see the call, and we really try to get back to people within the same day. Sometimes it overlaps depending on when you call in a day to the next day, but we're really trying to get back to people as soon as possible. For the most part, it's a lot of childcare calls. It's a lot of workplace calls. Certainly also calls, regarding just letting you know I tested positive, which is always great. But we're getting, in particular, what jumps out to me is a lot of childcare calls. I have a staff member positive. I have a child positive. I have a close contact. What do I do? And especially where the guidance has been changing, right? The CDC guidance has changed a bit. We get a lot of questions and calls regarding that. So please continue. If you're out and about in different spaces and you hear people asking questions, they're unsure of something, direct them to either call us directly and just say that they're, a Grafton resident or a Grafton business, and they can call us directly, or to call the Grafton Board of Health, talk to Nancy, and then she can log it for us. Any COVID questions?
Dan?
Well, yeah, I guess we might as well get into as you probably know, Colleen, we tabled a vote and a discussion, extended discussion on the emergency regulations requiring employers to report positive COVID-19 cases in the workplace.
Mhm.
And I still think, frankly, some of the verbiage is a little stern. And I'm not so sure, well, maybe you can tell us, have you gotten negative feedback or any positive feedback from Shrewsbury or West Boylston? Did they adopt this particular set of regulations?
I believe they did. I would have to check to be sure.
Mhm.
I know we passed it in the city. I believe Shrewsbury passed it. And I'm just thinking because of the call log and all the calls that we get.
Right.
I think for us, it is a good way to just have an idea of what's out there.
Yeah.
And I think a lot of employers would have potentially called us anyways because they
Right.
have questions about it, right? So a lot of times when somebody's calling to report, they're not just calling to report to say, letting you know, but all set, I know exactly what to do, right? Typically they're calling to report, but then they're also asking questions. And it provides one of our nurses to have that conversation and do that education with
Right.
them so that
Yeah.
hopefully they know right away what to do next time. It does add up though in terms of calls. I mean, there's one particular business in the city that I won't name, but one particular business in the city that I think within a span of a week, we had at least 2 to 3 calls a day.
Yeah.
Some from the employer, some from employees, right? So we'll also find that sometimes the employer does not contact us right away. We find out first because an employee says, oh, I saw that we're supposed to do that. I don't know if my boss did or is going to, so I'm going to let you know that I work here and I'm positive.
Yeah.
So it provides a lens into kind of what's going on in the community and just another opportunity to have those conversations. Certainly, do I
Yeah, I
think
think-
every employer calls us every single time?
Right.
I don't know, but we certainly get a lot of calls.
Yeah, and I think it's a great resource that you provide for them. Between tests being scarce and expensive,
Mhm.
employers already having a lot on their plate, I think we want to support them. We want to encourage them to reach out and let them know that the resources are available. But to say they have to immediately do this and that nobody likes mandates. I just think the wording of those particular regulations are a little stiff. And I know
And
it's
I think-
important to contact trace and look for clusters and all, but anyway.
I think you hit the nail on the head though, Dan. We're there to support them, right? So we want it to be a productive educational conversation. We don't want people to be afraid to call us to report a case, right? It's similar, I would say, to the way that Julie or Micah and that Phil always approached food inspections, right? That they're always looking for compliance, right?
Right.
Like you're having to do any type of enforcement action is always the last resort, right? And this is kind of the same concept, right? That it's really to support them and to be able to provide education to them on what to do.
I don't know. Bill, I think you had some thoughts, if you don't mind, Karen.
Yeah, this is Bill Muller. I share some of Dan's concerns. I think the way this is presented is that you must do this without really kind of articulating what the consequences are of having done so. I believe that the intent of it initially was contact tracing and identifying people within the same workplace that may have had common contacts and things of that sort. But it sounds like your implementation in Worcester is more as an informational resource. And it's not really sending people to do contact tracing and things of that sort. The CDC website that I looked at today is really kind of non-committal about it, you know, and actually raises some concerns about confidentiality of not identifying the person who was positive and things of that nature. I mean, I think you have provided a wonderful resource to the communities, and I think it's important for the employers to be aware of you as a resource. That will obviously, in this current surge environment, likely increase your calls even further. But I'm a little reluctant to kind of make it a mandate with potential adverse consequences if you are not in compliance with it. So it's interesting to hear exactly how it really has been rolled out in Worcester. And it doesn't sound like that's really, in practicality, what this sounds like on paper.
There's definitely the element of contact tracing, right? In the sense of if we're getting, you know, I can think of one business last week that had reported, I forget how many positive cases within a very short amount of time, which prompted a phone call with them to say, okay, what's going on, right? Like, what do we need to think about? Do we need to think about a deep cleaning here? Do we need to think, and the business actually proactively decided that they were going to shut down for a short period of time to do a deep cleaning, to be able to kind of do a reset, right? So certainly that is the case in some circumstances, right? There's a little bit more to it. Also, I would say, you know, we have a separate department of inspectional services that also does go out and visit establishments. And it could be anything from looking at signage regarding wearing your mask to, again, that educational piece. So the other elements are absolutely there. But certainly, you know, one of the main focuses is really just trying to gain compliance and education and to build that rapport with the retailers.
I do think that actually most of the employers who potentially would be subject to this, at least in the town of Grafton, are relatively small businesses. And I do think it's incredibly important for them to be aware of the resource that you offer to them. But I don't know that, you know, the way this is written, it sounds like it's more punitive than it is positive. And, you know, again, in the environment we're in, you know, there's so much pervasiveness of the current variant that it's kind of hard to do contact tracing. I'm sure you saw in the news that the Chinese city that had like 14 cases, and they checked several million people to be see if in fact they were positive. And, you know, obviously we're not in that sort of environment.
Karen, would you mind if we ask Austin about his opinion on these regulations for employers?
Yeah, some of the feedback I've gotten was just more concern with being out of compliance with it, concern that if the close contacts all had to isolate for so many days that their business would have to shut down, stuff like that. Like you said, the wording just being pretty strict, maybe.
Dan?
So, Karen, I don't know what you think, how we can try to get the word out that I think as a board, it's the consensus, we're not taking a vote, but would like to encourage employers to reach out and to report cases and have questions answered, as opposed to adopting an official emergency order. Is there a way to do that on the website, or Nancy might know too?
Well, I'm sure there is.
So,
Yeah, I mean, I would
What
think,
about- oh.
I would think we could write up something and then maybe send it to the list of folks that were sent the mask mandate email.
mhm.
Is there some sort of like COVID hotline number that we could give them, or an email maybe even? I know the call center, sometimes nobody wants to wait on hold.
In Grafton, all we have is Nancy / the office. You have the health department email, and then you have the office phone numbers.
Mhm.
There's no like separate COVID number.
Is there any number at the Alliance that we could give them? Do they have some sort of hotline in Worcester even?
So we've encouraged, I mean, certainly you can call, we tell businesses you can call the main number for the health department, or we provided all of them with our health@worcesterma.gov email address. So a lot of people will just email us. And then again, we check that email, we put that on the log, just like we would a telephone call, and then they'll get a call back. So that's certainly an option, that health@worcesterma.gov.
Right. Yeah, it's kind of like the Grafton Health Department email is a generic email that goes to the folks there. So yeah, all right, well, we can think of the best way to word something to make sure we're not saying it's a mandate, but also trying to get the point across to like strongly recommend.
And that we want to be helpful as well. And Nancy, here's a question for you, if you don't mind, Karen, is we have the list of establishments that Julie and Micah inspected. I don't know if they were able to get signage out about the masks, or did that go out on an email to these folks as far as the sign for their door?
Yes, the email went out last week to all the food establishments that I have, and then I contacted Cindy in the front office and economic development for other businesses. Any business, some of the gyms, the
Salons.
yeah, and out of
whatever.
all of them, sorry,
I was
out
gonna
of
say
all
like,
of those,
yeah.
yeah, about 15 came back undeliverable. So I have to find out who they are and then send them out. And went on Facebook and a couple of the groups. And if they didn't get it, we can mail it. We're closed, so we'd have to, I can email it. We'll get it out there.
So I might suggest, and I have some time Thursday and Friday, I can try to get together with Nancy and maybe anybody else to try to get something from the Board of Health into an email to these same businesses with information about helping them in terms of reporting and reacting and answering questions. I don't know when Jen is going to be back in action, but I can check Thursday or Friday. I'm going to be doing Booster Madness the next 2 days, but I'll check in if that's okay with you folks. I don't want to overstep any bounds, but I think that's the way to go at this stage of the game.
Okay by me.
Okay.
Thank you,
Thanks.
Dan.
All right. Is there anything else, Colleen, regarding COVID or anything else Alliance related?
I don't think so. I'm hoping at our next meeting in February, we'll be able to report that we've already peaked and we're coming back down. That's my hope. I'm hoping.
Agreed. I'm hoping that's the timeline too. I think we all are.
Yeah.
Ugh. All right. Thank you, Colleen. Next topic we have is was when we had set this up originally and then we tabled, there was going to be a public hearing regarding potential tobacco control updates. So instead of inviting Sherry and DJ to sit at today's meeting, because by the time we learned that it would be ideal to have a public hearing, it was too late to obviously get the public hearing posted and all of that per the requirements. So rather than have them sit here today and then have to turn around and ideally join us for a public hearing at the February meeting, we just said, you know, you can skip coming to this meeting. So we put this topic on the agenda. This is a continuation of the early December meeting where we had both Jerry and DJ in to talk about some recommended updates to our tobacco regulations. And at that point in time, with everything going on, we said, okay, give us some time to review them, digest them, and decide what we want to do. And then come the January meeting, we would proceed to discuss further and then vote on them. But then given the fact of needing a public hearing, we left it on the agenda for tonight at this point. So if any board members wanted to discuss any potential questions amongst ourselves without the public hearing happening in February, we could. But if there are no questions then or comments, then we can just pretty much bypass it at this point and then wait for the February meeting for the public hearing. Dan?
Yeah, I think everything looked pretty good when I finally got a chance to review it. The one part, I think it was number 2, was about banning so-called rolling papers, I guess. I understand the flavored ones, you know, are going to encourage children to smoke. I happen to have a client who actually still likes to roll real tobacco, and I suppose, and he has a friend that does too. I suppose they could go to a smoke shop or something to get them, but that's the only thing. I don't know of how anybody else feels about that.
I thought the same thing. I do like the idea of banning the flavored rolling papers, but maybe the regular ones are okay.
There might be some legitimate use to it. I don't know. But
Yeah.
Given the prices of cigarettes, which I can't believe.
Seriously.
But except for that, and we can think about it until before the next meeting.
All right. Well, there's nothing further on that. We will move on. All right, so COVID cases, vaccines, and mitigation efforts. I'm not going to reiterate either what we've already discussed or what Colleen brought up, but I'll do my usual numbers here as of January 10th. So today we've been informed of a total of 2,479 confirmed positive cases since tracking started back in early 2020. Looking at a weekly basis, so that would be last Friday and then through the prior Friday, we had 276 cases in that 1 week. And as we all know, most home kits that are done don't get reported from what they're showing. So take that 276 and add on a lot. Yeah, I've heard estimates anywhere from 50 to 100% more. So way more cases, as Colleen was saying, you know, with like Worcester and everything, like way more cases than we've ever seen in a week, especially considering at one point in time, we were at like, if we were lucky, maybe 20 cases a week. And now we're at 276 with a whole host of home kits, because every day you see people that are like multiple people trying to find home test kits. So, very big numbers, and yeah, fingers crossed that by the time we have our early February meeting, we're past this surge and the peak and starting to come down. There are a couple other variants out there, but they haven't seemed to be classified, at least at this point, as variants of concern. And one of them was found in France, coming out of Cameroon, with 48 mutations that they're still studying what the impact could be. And then Cyprus just reported what they're calling Deltacron, which is a looking at the genome so far, looks like a combination of some Delta and some Omicron characteristics to it. So potential variants of concern to come, hopefully not, but just something we all have to keep an eye on, that it's going to be, I think, a decent road, especially if either of those new variants or another variant starts to take hold. So it seems like, unfortunately, we've got some time to go here. Individuals, as always, we're strongly recommending and advising as a board to continue to exercise precautions. Even though for a large amount of the population, it seems thus far, Omicron is causing what would be considered a mild cold or a very mild cold, people are reporting, but unfortunately not everyone's that lucky. You do have the unvaccinated population, which may not be getting just a mild cold from it. You do have immunocompromised people, elderly, etc., who might be fully vaccinated and boosted, that may not be so lucky to just get a mild cold from it. So we all have to keep our precautions going and be diligent, and we're all in this together still. So besides that, we, I shouldn't say we, I wasn't at the meeting. On the January 3rd meeting, the board members that were in attendance did vote to do the face mask mandate for indoor public places in Grafton. And that, as we were talking about, did get posted on the website, different Facebook pages, was sent out to the businesses, etc. I haven't been out much to see how the businesses are doing, other than I did visit one place to do some shopping over the weekend. And for the most part, not 100% of people were wearing face masks, but definitely a large majority of people were wearing face masks. So good, but not perfect by any stretch. But definitely more people than I'd seen in previous times. If anyone's looking for information on exactly what that mask mandate entails and any potential exceptions, it is posted, as we mentioned, to the Board of Health website. And we'll say that anyone who lives, works, shops, socializes outside of Grafton or any other communities that have a mask mandate. So if you're in a place or a community that doesn't have a mask mandate in place, the CDC, as a reminder, is continuing to advise everyone to wear face masks when indoors in public places, regardless of your vaccination status. And then Massachusetts also has the advisory for wearing a face covering when indoors and not in your own home. So those still stand. They're not mandates, they're advisories and recommendations. I did see that Westboro did enact a mask mandate right around the same time as Grafton. Northborough also has a mask mandate in place. I know Millbury now was looking at enacting one. I don't know what the outcome of their vote was, though.
They
Yeah.
did.
Okay.
They voted to do it. Yep.
Yeah, it goes into effect on Wednesday, I think.
Okay. So yeah, more and more towns and communities around us seem to be joining in going down the path of a mask mandate because of just how bad the cases are at this point, to try to help as much as they can. That was all I had for that. Vaccines, we're continuing to strongly recommend that anyone who's eligible to be vaccinated, get vaccinated. And if you're eligible for a booster, to definitely get a booster. We're going to continue to say that. And I would say the best place to find information on the different vaccines, and also then obviously locations, along with eligibility guidelines. So if there's questions on how many months in between you're fully vaccinated to your booster, that can vary depending on the vaccine. For example, CDC and FDA just changed it from a 6 months now to a 5 months for Moderna and Pfizer. So that just recently changed. And I know there were changes along the lines for children and some populations of children, like the immunocompromised, now for getting their doses. So the best place, based on what your family population is, would be to go to the CDC's website and then also Massachusetts website has a whole host of information. And then the Massachusetts site, of course, then points you to various clinics, whether it be something like a CVS or a Walgreens, or the clinics like Colleen mentioned, or other locations. There are other like Shaw's, Price Chopper, other smaller clinics that are out there. So all of those resources are available to you based on what you're looking for, if you're searching for a booster or not. Dan?
I just wanted to mention, I found out through the Medical Reserve Corps that the Grafton schools are having a booster clinic from 4 to 6 this Wednesday.
Okay.
And so that'll be good.
Oh, that's good. So then we already touched on the mitigation efforts, because we had already talked about the mask mandate. And then we've already just talked about the potential business reporting regulation. So that was all I had for mitigation efforts. Any questions or comments regarding anything COVID related for the topic before we jump to the next topic? Nope, hearing none. All righty. Next topic, Rabies Clinic. For those that haven't been on the board as long, we used to host a rabies clinic. Usually, I think it was in April. With COVID, we didn't even attempt to host one last year because of all of the restrictions in place. But also on top of it, for years, since even before I had joined the board, for years, Dr. Rogers, local vet in town, had been gracious enough to help out with these rabies clinics. And we used to do them for citizens, dogs, cats, and ferrets within town. But then, as we know, Dr. Rogers retired. So then we were struggling. And last I knew, unless Nancy has a magical answer for me, continue to struggle to find a vet who's willing to do this. Typically it would be like a Saturday morning, I think like 9 to noon, and the town clerk would be there because you could work on dog licenses at the same time. But given we don't have all of the COVID restrictions in place, we did want to at least bring it up. But I think at this point, the biggest concern is going to be there's, last we knew, no vets that were necessarily willing and able to help with this.
That's correct, Karen. I am going to reach out to Melinda, Animal Control.
Yep.
And she will point me in the right direction.
Dan?
Yeah, and I would think Tufts, it might be worth a call to the small animal hospital at Tufts to see if they have someone or a student or something that could volunteer for a morning, you know.
I reached out to them. I don't remember when, but it was a lot of paperwork and insurance.
Yeah.
Yeah. And there was not enough time at that
Yeah.
point.
It's worth an ask.
Right.
Just because the past, time or two before the COVID year off, there was nothing that worked out. Doesn't mean potentially there won't be something this time. All right, next topic, April, May, June 2022 meeting schedule. All right, so our next meeting is February 7th, and then we have March 7th. So let's see. We could do April 4th.
Yep, I could do the 4th or the 11th. We'll shoot with the 4th.
Yep, either one's okay with me.
All right. And then May 2nd.
Yep.
Yep.
Right, so then we would have to go 5 weeks because we're not going to do it on 30th, which is, I'm sure, Memorial Day. So we could do June 6th.
Yep, that looks fine to me.
Works for me.
All right. Plan for those, and then if people learn of conflicts and for some reason we end up with a situation, it's rare that we have a situation where we're down to 3 out of 5 members, unless someone has like an emergency or urgent thing. We can always tweak it if we need to, as long as we know far enough in advance, obviously. All right. Tufts, next topic, Tufts biomedical permit / inspection, Benjamin Fontes. Nancy, I think you had wanted to put this on the agenda.
Right, so we got an email from us that Ben is no longer interested in pursuing inspections. So I just did find a file where Tim McInerney sent it out to bid when we hired Ben, and everything went through that office.
Oh,
So he wrote up he wrote up the description, he advertised it, it went out to bid, and Ben bid on it, and he ended up getting the position. Now, as far as the inspection, I don't know. I have no idea.
yeah, I have not had any time remotely to dig through any emails or anything to see, and I don't even know if me digging through emails probably would have found at best what you found about what Tim had done. I doubt it would have answered the question on the inspection side of things, if there was even an email in there about that. Dan?
Colleen, are you on the committee still at Tufts?
I am. I missed the December meeting because I was off that day, but I am. I think there's actually a meeting coming up in the next week or two.
Yeah, so maybe you could check for us to see what they know.
Sure.
Colleen, I'll forward you that email, okay?
Perfect.
Yeah, I don't want to subject them to an inspection, obviously, if they don't need it, but I don't want us to say, no, they don't need it, if lo and behold, there's something that requires it. All right. Last topic on the agenda stems from a piece of correspondence, long piece of correspondence that Austin read at the early December meeting regarding 244 Worcester Street, the Grafton Life Science Center, Eastern Retail Properties. So we added this onto the agenda for this meeting, since during that early December meeting, once Austin had read the correspondence that was received from some concerned citizens, the board members did say, although we as a board have nothing to do with like granting them a permit, we don't permit that type of facility or anything. We as a board did voice, I remember in that meeting, some concerns similar to what, at least some of the concerns that the citizens brought up during the letter. And I have it in my notes that there was suggestions from the board members to maybe acknowledge the citizens' concerns and also possibly engage with the other boards who are actually involved in the permitting process. I remember there was, I think it was Jen? I don't remember exactly. I think it was Jen who suggested maybe some type of letter to send to like the other boards. So I wanted to ask, and I know Jen's not here, but I didn't want to hold off and not bring it up at the meeting and wait a whole nother month. If anyone has started to draft any letter or knows if Jen perchance had started to draft anything. And then if there's nothing, which board member will take point for drafting said letter that the board can then use if we pursue going down the path of wanting to submit something. Dan?
Well, I will take point with contacting Jen first. And then we'll go from there. She seemed pretty passionate about it, or certainly concerned about it. And I honestly don't know all of the details, except that it sounds like a pretty big, potentially disrupting project. Do we happen to know who's going to be there? I don't,
No,
maybe not.
no.
It hasn't been publicized yet,
I
right?
don't think it's been publicized yet.
That
And I
might-
don't know, I'm even going from a publicized standpoint. I don't even know if the boards or anyone who's actually involved have even been told
Yeah,
this.
But
I
I'll-
honestly, from what I've heard and read, I honestly don't think, and don't 100% quote me on this, obviously, because we're not close enough to it, that anyone knows except for maybe the company who's working on building this. But even then, I mean, I know of situations where you build a building and then you lease the building. It
Right.
doesn't mean the building is being built specifically for a certain company.
Yep.
Totally. Yep.
But I'll volunteer to get in touch with Jen. I want to talk to her anyway by the end of this week and see see what she thinks about her writing skills.
Thank you, Dan. All right, so that's it that we had for topics. No mail or correspondence, since anything, upcoming meetings. So I mentioned February 7th and March 7th. And then now we have April 4th, May 2nd, and June 6th. So that is it.
Real quick, one thing that we did talk about last meeting, we made a recommendation for all meetings like in Grafton Town Hall to kind of be held remotely.
Oh.
And we had done it for 30 days, which doesn't cover up until our February meeting. Did we want to kind of make a motion or anything to kind of extend that into mid-February, especially the way the cases are going right now? I think we just did 30 days from the 3rd, was it?
Right. Yeah, I kind of think it should
We
be up to the discretion of the committee chairman, but it wouldn't hurt for us to say that we encourage remote meetings through the month of February or something to that effect. It's not going to be binding
Karen?
anyway.
Yep, Nancy.
We did receive an email from Evan. Obviously, we're closed to the public right now, that until further notice, we will be meeting remotely.
Okay,
I can forward that to you.
yeah.
Okay.
Perfect.
All right. There's nothing else. Is there a motion to close the meeting?
Yep, this is Dan Finn. I'd like to make a motion to close this meeting.
Is there a second?
It's Bill Muller, I second that.
All right, and then roll call vote.
Dan Finn, aye.
Austin Magnan, aye.
Bill Muller, aye.
Karen Gustowski, Govan, aye. All right, well, thank you, everyone. Stay warm. Sounds
Yeah.
like it's going to be a doozy tonight through tomorrow and tomorrow night